In this video, we will be testing hip mobility, particularly looking at the 4 ranges of movement at the hip, looking at your flexion movement, looking at extension, looking at internal rotation and external rotation. As I'm seated already, I'm going to show you the external rotation first. So you want to be sat on your bottom. You're going to be bringing the leg in front so that you have the foot and the knee in a nice straight line, and this other leg we're going to bring, if the mobility at your hip allows, to rest on the top leg. If not, if you know that that will cause you discomfort, or you know that there's issues at the hip, then you can look to bring it either in the crease of your leg or resting in front on the floor. So it will either look like something like this, which my hip mobility is quite tight, so you can see that I have a gap between my knee and my foot, and this is causing discomfort around my hip. We can look to bring it so that it's sitting in the crease like so, which is more comfortable for me, or we can bring it so that it's resting on the floor. When I'm resting on the floor, you can see that the legs are stacked on top of each other and my ankles are remaining straight. So I have mobility in this range, but as soon as I start to bring and increase that stretch, my ankle starts to want to deviate and take up some of the work that the hip mobility is lacking. So that's what you're looking for, is that you're looking to see if you can get ideally the legs stacked. If not, look to see where the leg is sitting in relation to the foot and what your ankle is doing, and this will give you a detail of whether there's mobility in the hip. Then retest on the opposite side. We'll then look at the internal rotation. For this, you need to be on all fours. You'll want it so that the knee is stacked under the hip, and we're going to take the leg out to the side. So we're bringing that foot out, keeping the knee under the hip. What we're looking for though is not how far out to the side you can go. We're looking at how far you can go out before you banana at the hip. So for me, as I take my leg out, if I go all the way, you should be able to see that I'm bananaing a little bit. So what we're looking for is at the point before I start to twist at my waist, which for me is about there. You don't have as much rotation in the internal as you do external, but you're looking to sort of see how it's feeling, if there's a difference between the two sides. Next up is looking at hip flexion, and we're going to be on our backs for this one. We'll lay down onto our back, keeping one leg flat on the floor. You're going to bring the knee towards the chest, hugging this in. I'm going to bring my arm down so you can see. And what you're looking for is, can you keep the other leg flat on the floor? And as you bring this knee towards the chest, are you able to bring the knee in towards the chest and have this contact between the stomach and the leg? Good mobility would indicate that you can keep the leg flat, you're not arching in the back, and that you are able to make contact. Any of these that I've mentioned, if you're not able to do that, would indicate that this range of movement is limited. The last one that you're looking at is the hip extension. For this, you're laying onto your tummies, laying flat, and then keeping the upper body and your back on the floor. You're looking to lift and raise that leg up off the ground, keeping everything in contact that I mentioned, and lowering down. Again, you don't have huge amounts of movement in that direction. You're looking to about roughly 10 degrees for the extension. If you're poor in range of movement in this direction, you'd be noticing things of either that there's arching happening in the back, you might be rotating slightly in order to get the leg off the ground. If there is anything you've noticed that is something that you're unsure about how to work, you can always drop us a message, check out some of our other videos on hip mobility.